Hello and welcome! Have you ever noticed more hair in your brush than usual? Or felt that your hair is thinning faster than it used to? Hair loss is one of the most common concerns affecting millions of people worldwide, regardless of age or gender. In today's video, we'll dive deep into hair loss, why it happens, what causes it, and the most effective ways to treat and prevent it. By the end, you'll understand the science behind hair growth, the factors that can accelerate hair loss, and practical strategies to protect and restore your hair. Before we start, remember, hair loss is often normal, but excessive or sudden loss can indicate something underlying, and understanding the cause is the first step toward healthy hair. Let's begin our journey. Hair is not just cosmetic, it reflects your overall health. Each follicle has a life cycle, and each strand of hair is constantly growing, resting, and shedding. On average, we lose 50100 hairs daily, and this is completely natural. But when hair loss exceeds this number, or your hair becomes thinner, it's time to investigate the reasons behind it.
Let's start by understanding the causes of hair loss. There isn't just one reason. Hair loss is usually a combination of factors. We'll explore genetics, hormones, medical conditions, nutritional deficiencies, and lifestyle factors with detailed explanations and real-life examples. -1. Genetics 10:30 to 20 o'clock voiceover. The most common cause of hair loss is genetics, often called male or female pattern baldness. Genetics determines how sensitive your hair follicles are to hormones like DHT, which gradually shrink follicles and slow hair growth. Men, hair usually thins at the temples and crown, eventually forming a classic N-shape or bald spot. Women, hair thinning is often more diffuse, across the top and sides, without a distinct bald area. Studies show that over 50% of men and 30% of women experience pattern hair loss by age 50. Example story: John, 35, noticed his hairline receding over 5 years. His father and grandfather also experienced hair loss. After consulting a dermatologist, John started a treatment plan combining Minoxidil and lifestyle changes, which helped slow the thinning significantly. Visuals: before and after hairline illustrations, family genetics chart, animated DHT effect on follicles. Tip for viewers: if you have a family history of baldness, early intervention with medical treatments can preserve hair and slow progression. -2. Hormonal changes. Hormones have a powerful influence on hair growth. Changes in hormone levels can trigger shedding, thinning, or even patchy bald spots. Pregnancy and postpartum. During pregnancy, high estrogen levels prolong the growth phase, often resulting in thicker hair. After childbirth, estrogen drops, and many women experience postpartum shedding, which usually resolves within 6 to 12 months. Menopause. Lower estrogen levels during menopause can thin hair. Women may notice hair on their parting line becoming wider. Thyroid disorders. Hypothyroidism or hyperthyroidism disrupt the hair cycle, leading to diffuse thinning. Stress hormones. Cortisol. High stress pushes hair follicles into the telogen phase, causing temporary but noticeable shedding, often 2 to 3 months after stressful events. Example story: Sarah, 42, experienced hair thinning after menopause. By adjusting her diet, taking supplements, and starting low-level laser therapy, she was able to restore volume over a year. Regular checkups for thyroid and hormonal balance can prevent long-term hair loss caused by hormonal imbalance.
3. Medical conditions. Medical conditions can be another major cause. Let's look at some common ones. 1. Alopecia areata, an autoimmune condition where the body attacks hair follicles, causing patchy bald spots. In severe cases, it may affect the entire scalp. 2. Scalp infections. Fungal infections like ringworm weaken follicles and cause shedding. 3. Chronic illnesses. Conditions like lupus, diabetes, or anemia can interfere with normal hair growth cycles. Example story: Mark, 28, developed small bald patches due to alopecia areata. His dermatologist recommended corticosteroid injections and topical treatments, and over 6 months, most of his hair regrew. Seek professional advice if hair loss is sudden, patchy, or severe, as early intervention improves recovery chances. 4. Nutritional deficiencies. Hair health is deeply linked to nutrition. Lack of essential nutrients can weaken follicles and reduce growth. Protein. Hair is primarily keratin, a protein. Low intake slows growth. Iron. Essential for oxygen delivery to follicles, deficiency causes shedding. Vitamin D and B12. Regulate follicle function and new hair growth. Zinc and biotin support hair structure and strength. Example story: Emma, 30, was losing hair rapidly due to iron deficiency. After correcting her diet and taking supplements, her hair regrowth was noticeable in 4 to 6 months. A balanced diet with supplements when necessary prevents nutrient-related hair loss. 5. Lifestyle factors. Finally, lifestyle factors play a crucial role. Stress. Chronic stress triggers shedding telogen effluvium. Hair care routines, overuse of dyes, heat, tight hairstyles, and chemical treatments damages follicles. Environmental factors, pollution, UV exposure, and hard water can weaken hair. Example story: Alex, 25, noticed thinning after months of stress and daily hair straightening. By reducing stress, improving his hair routine, and using mild shampoos, he regained thickness over a year. Simple lifestyle changes like reducing stress and gentle hair care make a huge difference over time. Now that we understand the causes, it's time to explore how to treat and manage hair loss effectively. A successful approach usually combines medical treatments, natural remedies, professional procedures, and lifestyle adjustments. 1. Medical treatments 60 to 30, 80-0. Medical treatments are often the first line of defense for pattern hair loss or other serious conditions. Let's break down the most common options. A. Minoxidil Rogaine. A topical solution applied directly to the scalp. Stimulates hair follicles and extends the growth phase. Anagen. Works for both men and women, though results appear after 3 to 6 months. Side effects may include scalp irritation or dryness. Example story: David, 40, started Minoxidil after noticing thinning at the crown. By month 4, he noticed new hair growth, and by month 8, his hair density improved noticeably. B. Finasteride Propecia, prescription oral medication for men. Blocks DHT, the hormone that shrinks follicles. Can slow or even reverse male pattern baldness. Side effects may include mild sexual dysfunction in a small percentage of users. Example story: Michael, 35, combined Finasteride with Minoxidil. Within a year, his hairline stabilized and he retained most of his existing hair. C. Corticosteroids, often used for autoimmune hair loss like alopecia areata, can be injected into the scalp or applied topically to reduce inflammation. D. Other medications, spironolactone for women with hormonal hair loss. Dutasteride stronger DHT blocker, prescription only, tip for viewers. Always consult a dermatologist before starting medications to ensure safety and monitor side effects. Natural remedies. Natural remedies are useful complements to medical treatments and can improve hair quality. A scalp massage improves blood circulation to follicles. Can be done with fingertips or specialized massagers, 5 to 10 minutes daily. The essential oils, rosemary, peppermint, and coconut oils are popular. May strengthen hair and promote growth when massaged into the scalp regularly. C. Balanced diet, rich in protein: eggs, fish, legumes, iron spinach, red meat, vitamins D and B12, zinc, and biotin. Hydration also matters. Dehydration can make hair brittle. Example story: Sophie, 28, combined scalp massage, rosemary oil, and dietary improvements. Over 6 months, her hair felt thicker and stronger, though she also continued medical treatment for better results. Even small daily habits like gentle massage or nutrient-rich meals can significantly improve hair health over time. 3. Professional treatments. For severe or advanced hair loss, professional treatments may be necessary. A hair transplant surgery. Follicular units are moved from dense areas to thinning regions. Can provide permanent results for suitable candidates. Requires recovery time and post-op care. B. Platelet-rich plasma PRP therapy. Patient's own blood is processed to concentrate growth factors, injected into the scalp to stimulate follicles. Effective for early-stage hair loss or thinning hair. C. Low-level laser therapy LLLT. Non-invasive, uses light to stimulate follicle growth, often used as a supplement to medications or PRP. Example story. Kevin, 45, underwent PRP combined with laser therapy and Minoxidil. After 12 months, his hair density increased significantly, and he avoided the need for a transplant. Professional treatments are most effective when started early and often work best in combination with home care and medical treatments.
4. Lifestyle adjustments. Lifestyle changes are crucial for long-term hair health. Stress reduction, meditation, yoga, exercise, or even hobbies can lower cortisol and reduce shedding. Hair care routine. Avoid tight hairstyles, excessive heat, and harsh chemical treatments. Regular checkups. Monitor thyroid, iron levels, and other conditions that may affect hair. Protect from environment. Wear hats in strong sun, use gentle shampoos, and avoid pollution exposure when possible. Example story. Anna, 32, had chronic hair thinning due to stress and hairstyling. By adopting gentle hair care, practicing yoga, and adjusting her diet, she regained noticeable volume in a year. Consistent lifestyle adjustments reinforce medical treatments and natural remedies, creating the best environment for hair growth. Hair loss can be challenging and emotionally taxing, but understanding the causes and taking comprehensive action makes a huge difference. Combining medical treatments, natural remedies, professional procedures, and lifestyle adjustments is the most effective strategy. Remember, early intervention, patience, and consistency are key. Consult a dermatologist if you notice sudden, excessive, or patchy hair loss, and create a plan tailored to your hair type and needs. Thank you for watching. If you found this video helpful, like, share, and subscribe for more expert tips on hair health and wellness.